if a woman is HIV positive and has put to bed, the question is, can she breastfeed her baby without transmitting HIV from herself to her baby through breast milk? The answer to that question is yes. But there is something that must be fulfilled before this can be practiced safely. And that is, that woman's viral load should be undetectable, which means when that woman goes to the lab and does a HIV viral load test, they're supposed to tell her that they cannot find any viral level, any virus in her blood, which means her viral load is 0. They cannot detect it. Okay? She's HIV positive, but her viral load is undetectable. That is the only condition on which it is safe for her to breastfeed. If they can detect her viral load level, or there's a detectable viral load, she should not breastfeed, which means there is a high chance that there will be HIV virus in her breast milk, and obviously her baby becomes exposed to the HIV virus. Now let's assume that this woman is taking her, her antiretroviral medications, HIV medications, judiciously. She takes it every day, and her viral load is undetectable. There are still some precautions that she needs to know. Now, if she herself is unwell, especially if she's vomiting or she's having loose stools, tummy upset, she should not breastfeed for a few days until she has fully recovered, until a few days after she has recovered. The reason is because during that period when she's purging or vomiting, there's a likelihood that her HIV medications may not be absorbed well into her body. And at that point, her viral load, which was previously undetected, may now be at a detectable level, and she might now transmit the virus, expose her baby to the infection. Now, even if she's breastfeeding because her viral level is undetectable, if her baby has diarrhea or is vomiting, which means the baby's bowel or the gut is inflamed, what we call gastroenteritis, the baby becomes exposed. The baby becomes at increased risk of contracting the virus through the breast milk. So at that point, we say, okay, she should stop breastfeeding until the baby has fully recovered, until a couple of days, about 2 or 3 days, after the baby is purging and vomiting has settled. Now, if that woman has, breast inflammation, breast infection, if her nipple is painful and cracked, at that point, we'll also say, if it's only one nipple, we'll say, okay, you should breastfeed, on the other breast until that particular nipple that is sore, painful, and cracked has fully healed. If it's both nipples that are inflamed, then we'll say don't breastfeed until the breast, inflammation or infection or cracks have fully resolved or fully healed. In terms of transmission, preventing transmission of HIV virus from the mother to the baby through breastfeeding, the best advice is usually for that woman not to breastfeed at all. Not to breastfeed at all. So formula feeding is the best way, okay, of preventing HIV transmission through breast milk. But remember, if a mother decides that she wants to breastfeed, the best advice is that her viral load should be undetectable, and combined with this other advice that I've mentioned, and obviously she should be discussing with her clinician, her healthcare provider at the HIV clinic, to ensure that she's in good health, her baby is in good health. Sometimes they might also advise that the baby might be on a preventative or prophylactic treatment, antiviral treatment as well. If her viral load is undetectable, they may not place the baby on medications. But for extra precaution, some healthcare providers might still advise that the baby also takes some antiretroviral, preventive treatment. I hope this video has been helpful. If you have any questions regarding HIV transmission from mother to child and how this can be prevented, do well to leave it in the comment section, and I'll try my best to answer you as much as I can. Thank you.